Society, the medical community included, would have us all believe that disease risk, police assault, and early death are all due to individual behaviors, especially within communities of color. If we act right, if we eat right, then we'll be all right. As if the inevitability of diet-related diseases and dying on the streets is simply based on personal choice.
Wow, Dr. Hancock, thank you so much for joining us.
Thank you for having me.
Yeah, and it's kind of hard to follow that up with someone who's saying, well, you know, you do have a choice. But you're right. I mean, don't blame it on the victim, right? And I think that's the point you're trying to make. So yeah, so thank you for being with us today. And I know that I've heard a lot about you and sort of the whole thing about disparities in healthcare and what's happening in our community. But today we're talking about the DC Nutrition Equity Act. And can you please share with our audience what that's all about and why the American Heart Association is involved?
Absolutely. So the Nutrition Equity Amendment Act is an amazing piece of legislation coming out of Council Member Nadeau's office, championed by a diverse array of coalition members. What it does is it allows for critical, necessary, and sustainable funding to provide for healthy foods within communities, particularly communities hardest hit by health disparities like diabetes and obesity. It provides community-wide nutrition education, particularly targeting communities east of the river that have been disproportionately impacted by diseases like diabetes and obesity. And one of the reasons why our coalition has come together with an array of people from national organizations like the American Heart Association and the Center for Science in the Public Interest to food justice leaders in the DC community itself. DC Green, Spaces in Action, Don't Mute My Health, the University of George Washington University, myself as one of the professors and a physician, we've all come together to champion nutrition equity, because we know, really based on what we've seen with COVID-19, nutrition-related chronic diseases were a leading risk factor for COVID-19 severity and death. So there's no time like the present to have legislation like this passed.
But you talked about one part of the legislation, which I think people would agree with. I mean, we know, particularly in the community where our newspaper is and actually where I live, some still consider it a food desert. We know access to healthcare is still a challenge. We have a hospital that doesn't provide all the services that the community needs, and some have had to travel across town and even outside of the city for healthcare. I think part of it makes a lot of sense. I think the other part that seems to be most controversial is with regards to this additional, I don't know if we call it a tax or a surcharge or something that the amendment asks for to be placed on quote unquote sugary drinks. Can you talk about that a little bit?
Absolutely. The Nutrition Equity Catalyst Tax that's included with this legislation is a 1.5 cents per ounce excise tax that will be applied to the distributor, where they can decide whether or not they then translate that cost over to the consumer. What this does is it replaces the current sales tax that's currently on sugary drinks in the District of Columbia. This funding is going to be committed to improving food in shelter systems, where some of our most vulnerable communities, part of a fresh start is the food that they eat. It provides funding for food literacy programs in elementary schools across the district. It actually invests in Black and brown businesses that speak specifically to addressing food insecurity and nutrition inequities. It also allows for food as medicine programs so that physicians like myself can actually prescribe fruits and vegetables to our communities. I used to see patients east of the river in southeast, as we say. So I understand not only food swamps, but also food deserts. And that's what this catalyst tax helps us to facilitate. And the reason why an excise tax is much better than a sales tax is once you've committed to the purchase of a product, how much it costs at the checkout does not change behavior. We look at cities like Philadelphia, countries like Mexico, states like California who have passed similar excise taxes, and we have seen not only increase in terms of these programs that I just described, but we also see decrease in terms of the consumption of sugary drinks, which is the leading source of added sugar in the American diet. And when we know that we decrease sugary drink consumption and decrease sugar consumption, that decreases the risk of diseases like diabetes, obesity, the things that are killing us the most.
You know, I want to raise a question that one of our viewers, Eric Jessup, just asked, and that is, can we champion nutrition equity without government enforcement? And one of the things that I've observed, particularly in one of our delis, right? It's a great, we call it a deli, MLK Deli in our neighborhood. Just sort of observation. Other than their homemade lemonades and strawberry drinks that they make over there, the most I think purchased drink is water. And so the sodas don't seem to move that well. And so, you know, I'm wondering, I'm with Eric, does it take government intervention or government enforcement to change habits?
I believe that that's an excellent question in terms of the government's role in facilitating behavior change. You look at seatbelt laws, car seat laws, the tax on tobacco. It wasn't until those government partnerships in terms of a public health policy partnership that we saw behavior change. The reason why there was a decline in smoking wasn't because the Surgeon General put a label on the package. That changed no behavior. But when we started to implement a tax on cigarettes, not only did it across the board decrease cigarette use, but particularly in our adolescent population, right? When we think about seatbelt use, car seat use, it wasn't until you have a ticket assigned to what should be common sense that people do it. And it isn't that this catalyst tax takes away choice. You have a choice. You can either assume to pay the additional 30 cents for this 20-ounce bottle of Coke, or you choose not to, and instead is, to your point, buy water. I remember growing up being a recipient of entitlement programs. We received food stamps when you had to rip them out of a book. We very rarely had soda because my mother had to make specific economic choices about what we could and could not afford. And what this does is it facilitates choice based on the cost right there on the shelf, right? That's what we know changes behavior. Studies have demonstrated that when you change the price on the shelf, that's what reduces sugary drink consumption. Philadelphia is a perfect example. They showed a almost 40% reduction in sugary drink consumption based on the excise tax that was passed back in 2017. That's what we want to do, is to facilitate this choice. When we talk about targeted marketing, soda industry target markets Black and brown communities to make sure that they become intimate with us in terms of our loyalty to product purchase. What this does is it facilitates a healthier choice.
Well, you know, I'm glad that you came on. I think this is, I mean, this battle has been going on for, I don't want to call it battle, but this initiative has been going on for quite some time, and it's worn different hats. And so now it's before the council, and we will probably, you know, have others on who have, you know, maybe differing viewpoints about it, because I think we need to have an informed community that knows what the council will be looking at in the next couple of weeks. So Dr. Hancock, thank you so very much for joining us and for sharing a perspective that our viewers need to hear. And hopefully we'll have you back sometime to talk about some other issues involving healthcare in our community.
Hopefully so. Thanks for having me.
All righty. Thanks much.